Hello, my name is Danielle Willis, Vice President of Human Resources for National Church Residences. It is my pleasure to introduce Bill Shemp, partner with ClearPath Benefit Advisors. In light of our upcoming changes for the 2015 healthcare plan year, we've asked Bill to speak with us today about the plan choices we will have during open enrollment and for our 2015 plan year. Bill?
Thank you, Danielle. Today, for the time that we have together, we look forward to sharing information about your upcoming open enrollment period and the changes that we are introducing this year for the full-time benefit-eligible staff at National Church Residences. Our goal today, as you can see from the slide in front of you, is to talk about why we are restructuring the medical plan benefits that are available to you. We'll give you your open enrollment dates, the process for open enrollment, how the plan covers your medical and prescription drug expenses, payroll deductions. Two of the plans that you will now have available to you may qualify you for a health savings account. So we will talk about how those accounts can be advantageous to you and, of course, how we need your help. We are restructuring the medical plans for various different reasons. The first is to be in compliance with the healthcare reform law. The healthcare reform law that was passed several years ago requires employers to adapt their medical plans to meet the requirements of the law. And of course, National Church residents will be in full compliance with the law with the restructuring of these plans. Secondly is to offer a consistent level of benefits and payroll deductions to all National Church residents, associates, and full-time benefit-eligible staff. Third is to offer plans that meet the personal needs of a diverse demographic population at National Church residents. We recognize that the needs and objectives of each of you may differ. And rather than offer one plan for all of you, it is the goal of National Church residents to be able to offer plans that can meet the objectives of each of you. In this way, we will allow each of you to select a plan that best meets your needs and your objectives. This does not, however, automatically reduce the National Church residences' cost for the medical plans that they offer to you. This is not the objective of this restructuring. In fact, National Church residents will be increasing the amount that they contribute toward the cost of these medical plans. The cost of medical plans continues to increase and escalate at a high rate. National Church residents continues to fund a very high percentage of the cost to help keep your payroll deductions to a minimum. And so this restructuring is to help you bring alternatives to the table for you and not necessarily just reduce the cost for National Church residents. Medical plans will continue with United Healthcare. As a result, you will not need to change any relationships that you have with your current physicians or other providers unless they were to choose to terminate those relationships with United Healthcare. By maintaining our relationship with United Healthcare, you will be part of the largest healthcare network in the United States, and you will have a broad selection of providers available to you to meet your medical needs when those might arise. The other benefits that are available to you by being a full-time benefit-eligible staff person at National Church residences are not changing. So there'll be no change this year to your dental plan, life insurance, short and long-term disability plan, your long-term care benefits, the medical flexible spending account, and the dependent care reimbursements. The changes occurring this year are limited to the medical plan options that you have. Your open enrollment dates will be November the 17th through December the 5th at 9 p.m. Eastern Standard Time. This is a definite hard date. We do need you to please take action before the end of open enrollment so that we can guarantee that you have coverage effective January the 1st of 2015, and so that for those of you electing medical plan coverage at National Church residences, that you can have your United Healthcare ID cards before the 1st of the year. There can be no exceptions to this deadline, so please conform to the December 5th at 9 p.m. Eastern Standard Time deadline. Printed communication will certainly be provided to you. The target distribution date is the week of November the 3rd through the 7th. So look for a packet from National Church residents that will be delivered to your home address in that week leading up to the start of your open enrollment period. As you engage into the open enrollment process at National Church Residence, you will continue to use the enrollment system we have enjoyed in the past called Benefit Connect. You will have a login and a password. Your password will simply be your Social Security number. For those of you who do not have access to a web-based enrollment system or who may have questions as they are going through the enrollment process, we will make available to you a full-service call center. This call center will be available at convenient hours for you. You will be able to call, talk to licensed insurance professionals who can explain your options that are available to you with National Church Residence, and actually enroll you in the plan of your preference if that's what you would like to do while on the telephone call with the advisors. So whether it is convenient for you to use the web-based system, or if you'd like to access the call center, we've made both options available to you. As always, you also can call your Human Resource Department at National Church Residences. You can ask for Pat Kelker or Denise Davis, and they would be more than happy to be of assistance to you as well. Okay, let's talk a little bit more detail about the medical plans that you're going to have available to you starting on January the 1st, 2015 with National Church Residences. You will have 4 total plans for which to choose. 2 of the plans are what we call a PPO plan, which simply stands for Preferred Provider Organization. 2 other plans, if you so choose, may qualify you to be able to have a health savings account, which is a tax advantage savings account at a bank of your preference. We will talk about how a health savings account operates and how it might be an advantage to you later in the presentation. Let's first talk about the 2 PPO plans. We will offer one plan that will have a lower deductible than what is available to you today, and we'll have a second PPO plan that has a higher deductible than what you have available to you today. For those of you who have been asking for a plan with maybe a little bit lower deductible than what is offered, you'll now have that option available to you on January the 1st. The 2 health savings account qualified plans will have higher deductibles than the 2 PPO plans. For those of you who are comfortable with a higher deductible and would like to be able to have a health savings account at the bank of your preference, we wanted to make this option available to you so that you could take advantage of it. Insurance 101 will always say that the lower the deductible of a medical plan, the higher the cost. The higher the deductible of the medical plan, the lower the cost for that coverage. Correspondingly, the lower the deductible of your medical plan, the higher the payroll deduction will be. And the higher the deductible under the medical plan, you will have the lowest payroll deduction available to you. So you'll have 4 plans with various deductibles to choose from, and as a result, with various payroll deductions available to you. Let's talk generally how a PPO plan compares to a health savings account qualified plan. First, a PPO plan will have co-payments for selected services if you incur those services in the network and that you do not have to meet your deductible first before using the co-payments. These co-payments are for office visits to in-network physicians, whether it's a primary care doctor or a specialist, urgent care centers in the network, emergency rooms, whether it's in or out of the network, and prescription drug benefits from pharmacies inside the network. You will receive a higher level of benefit anytime you use a provider that is inside the United Healthcare network. We strongly encourage that whenever possible you use the in-network providers available to you through United Healthcare. You will receive a higher level of benefits, and just as importantly, a discount has been negotiated on your behalf, and you are only responsible for paying the negotiated discounted price. So to reduce your out-of-pocket expenses as much as possible, always use an in-network United Healthcare provider. Both PPO plans will also provide an annual out-of-pocket limit for you. In this way, you know that regardless of how high my medical expenses might be within the calendar year, there is a limit of those expenses that I will be responsible for sharing in. This out-of-pocket limit is really the key component of all 4 medical plans. The primary purpose of medical plans today offered by National Church Residences is to limit your potential out-of-pocket exposure toward medical expenses in the event you were to have large expenses within inside a calendar year. Co-payments will now apply toward your out-of-pocket limit. This is an enhancement of the coverage over what it is prior to January the 1st of 2015. Also would like to remind you that if you are receiving routine preventative care, and if you're receiving routine preventative care inside the United Healthcare network of providers, if those providers code your visit as a routine preventative visit as they send the bill to United Healthcare, and assuming it is a covered expense under the contract, your routine preventative expenses will be paid at 100%. You will have no out-of-pocket expense at all for having your routine preventative expenses. Unfortunately, there's no longer an excuse for not having that annual checkup with your favorite doctor. Coinsurance after the deductible is something where the United Healthcare plan will pay a percentage of the expenses that you are incurring, and you will share in the remainder of those expenses as well. The coinsurance does not kick in until after the deductible has been satisfied at any point during the calendar year. So let's take a look at the other 2 plans, the plans that could potentially qualify you to have a health savings account, and how do they compare with the PPO plan. Well, first, with those 2 plans, there are no co-payments available prior to meeting your deductible. Your office visit to your physician, urgent care centers, emergency room expenses, and prescription drugs are covered expenses. They are simply subject to the deductible as any other expense would be. Prescription drug co-payments are available once you satisfy your deductible at that point in the calendar year. Just like in the PPO plan, there is a network of providers that you can access for your care. And anytime you are in the network, you will get a higher level of benefits, and a negotiated discount has been negotiated for you in advance. The health savings account qualified plans also provide you an out-of-pocket maximum that you would be responsible for in any one calendar year of your medical expenses. Just like the PPO plans, your health savings account qualified plans also will pay for your routine preventative expenses at 100%. They are not subject to your deductible under these 2 plans either. Remember, anytime you're receiving routine preventative care, it's important that you receive those services in the network, that the providers code the visit as a routine preventative expense, and that it is a covered eligible expense. Assuming those are true, your services will be paid at 100% with no out-of-pocket requirement from you. One of the health savings account qualified plans will have coinsurance after the deductible. One will have no coinsurance after the deductible. In fact, your eligible in-network expenses, unless limited somewhere in the contract, will be paid at 100%, exclusive of prescription drug copays, once you were to exceed your deductible. We'll certainly give you some more details of those in just a minute. A couple things I'd like to point out before we proceed any further about how the 2 plans compare with each other. When you are deciding which plan might best suit your needs, we have structured it so that you do not need to worry about a couple things. First, between all 4 plans, all covered expenses are exactly the same. You do not need to worry if I choose one plan, do I lose eligibility of coverage for one type of services versus another plan. We have literally made the things that are covered and eligible under the medical plan exactly the same between all 4 plans. The plans will reimburse those expenses and pay your providers differently based upon deductibles and coinsurance and out-of-pocket limits, but you do not need to worry about losing coverage for something if you choose one plan versus the other. Secondly, and just as important, all 4 plans will use the exact same network of hospitals, doctors, pharmacies, labs, so that you do not need to worry about checking to see if your doctor participates with one plan or the other. If your doctor is participating in one plan, your doctor will be participating in all of the plans. So when you sit down to decide which plan might be best for you, take a look at the financial aspects of it. You do not need to worry about, am I going to lose coverage for one service or another? And you do not need to worry about, is one doctor going to be participating in one plan and not the other? We have taken that worry away from you. Now we're going to talk in a little bit more detail about how the 4 different plans compare. The first one we will talk about is the PPO Plan 1. This is the plan that will have the lowest deductible and the highest payroll deduction. Beginning every January the 1st through December 31st of every year, you will be responsible for a deductible. As expenses are incurred and then sent to United Healthcare by your providers, if the expense is not covered by a copayment, it will be subject to a deductible. When something is subject to the plan's deductible, it is your responsibility to make those payments. Remember, if you're incurring the expense inside the network, a discount has been negotiated for you, and you are only responsible to pay those providers the negotiated discounted rate. For the PPO Plan 1, your annual deductible is $1,500 per person. If you're covering any family members, there's a maximum family deductible of $3,000, but never more than $1,500 on any one person within the family. If your expenses before the end of the year were to exceed the $1,500 deductible limit, and assuming the expenses are covered under the policy and not limited in the contract, and you are incurring the expenses in the network, they will be paid at 80%, and you would be only responsible for 20% of your expenses that you're incurring after you exceeded the deductible. Now here comes really the most important part of all 4 medical plans. At what point during the year, if my medical expenses exceed a certain level, am I no longer responsible for having to share in the expense of it? What is, in other words, my maximum annual out-of-pocket limit, except for expenses perhaps excluded or limited somewhere else in the contract? Under the PPO Plan 1, your maximum potential out-of-pocket in-network expenses is $3,800 a year per person, and there is a maximum for the entire family of $7,600. If the expenses that you're incurring that were not subject to a copayment were to exceed that level, then for the remainder of the calendar year, your eligible in-network charges would be paid at 100%. You might be asking, well, what things are covered with a copayment? So once again, those are in-network office visits to physicians, in-network urgent care centers, emergency rooms, regardless if it's in the network or not. When seeking emergency care, you do not need to be concerned if the hospital is in the network. It will always be paid as if it is. And prescription drugs received from a pharmacy inside the United Healthcare network. Remember, all co-payments are subject to your out-of-pocket maximum. Let's take a look at Plan 2 and see how that might differ from Plan 1. It works exactly the same as PPO Plan 1. Same network of doctors, same things covered, simply a different deductible and a different out-of-pocket maximum. If you were to elect PPO Plan 2, your calendar year deductible for in-network expenses would be $2,500 per person with a $5,000 family maximum deductible. At any point during the year when you would exceed that deductible, then your eligible in-network expenses would be paid at 80%. You would have responsibility for the other 20%. You have an annual out-of-pocket maximum that you would have to incur, including all co-payments. And under PPO Plan 2, that maximum out-of-pocket annual maximum is $4,800 per person with a family maximum out-of-pocket exposure of $9,600. Let's take a look at the other 2 plans that you have available. The next 2 plans I'm going to talk about may potentially qualify you for having, if you would like, what's called a health savings account, or HSA for short, at a bank of your preference. Let's talk about how the medical plan associated with these plans work. So HSA Plan 3 has the same covered expenses as the two PPO plans, has the same network of hospitals and doctors. It just has a deductible of $3,500 per calendar year, or a family maximum of $7,000 within the calendar year. A key difference of the health savings account qualified plans as required by federal law is that your office visit charges, urgent care center expenses, emergency room expenses, and prescription drug expenses prior to meeting your deductible are not covered by a copayment. They are simply subject to the plan's annual deductible. You do receive credit for those expenses as you are accumulating expenses toward your deductible. And even though you have the health savings account qualified plans, the same discount has been negotiated for you in advance that you would have under the PPO plans. So even though the physician office visit could be your responsibility until you exceed the deductible, you're only responsible for the negotiated discounted rate, not the full charge of the office visit. Under the HSA Plan number 3, once you were to exceed the plan's annual deductible, you have absolutely no coinsurance. The plan then pays 100% of your eligible in-network expenses that you have after exceeding the deductible, except for any expense that may be limited or excluded inside the contract. So your maximum out-of-pocket exposure for medical expenses is limited to your deductible of $3,500 per person, or $7,000 per family. Prescription drug co-payments do kick in for prescriptions that you would have after you meet the deductible under the HSA Plan number 3. If you were to incur prescription drug co-payments before the end of the year that totaled more than $1,000 per person, or $2,000 for the family, then your prescription drug co-pays are no longer required, and your prescription drugs would also be paid at 100%, as are your medical expenses at that point. The final plan that you have available to you is the HSA Plan number 4. This plan has the highest available annual deductible, and as a result has the lowest payroll deduction of all the 4 plans that are offered. This plan also could potentially qualify you for a health savings account if that's what you would like to have. This plan has a deductible of $5,000 inside the calendar year and a family maximum of $10,000. If you were to exceed the plan's annual deductible, then your eligible in-network expenses would be paid at 75%, and you would be responsible for the other 25%. You would also have prescription drug co-payments available to you after meeting the deductible. Your maximum out-of-pocket exposure for HSA Plan number 4 is $6,000 per person, or $12,000 family maximum. Your 25% coinsurance that you might be paying and your prescription drug co-payments apply toward the plan's annual out-of-pocket maximum. If you were to exceed the plan's annual out-of-pocket maximum, all of your eligible in-network expenses, unless limited somewhere in the contract, including prescription drug co-payments, would be paid at 100% for the remainder of the calendar year. It's important to remember that with the health savings account optional plans, you will use the same network that might be available to you under the PPO plans, and you would have the same covered expenses also available to you under the PPO plans. We will now talk a little bit about some of the other features associated with the health savings account, but I want to also emphasize that you may not qualify under the Internal Revenue Service rules for a health savings account. That does not preclude you from selecting HSA Plan number 3 or HSA Plan number 4. It is perfectly okay to select those plans to cover your medical expenses and never open a health savings account at the bank of your preference. If you do not open a health savings account, it does not affect your medical coverage at all. The health savings accounts are controlled by you at the bank of your preference, not by United Healthcare. Before we move on to those, I wanted just to give you one last summary of how the plans might compare on a matrix so you can look across the screen and see what your options are available to you. As you can see from this matrix, we have listed all of the different deductibles for each of the 4 plans, what the coinsurance level is, assuming in-network eligible expenses, and what the in-network out-of-pocket maximum expense would be under each plan. Please look carefully that the HSA 3 plan out-of-pocket limit does not include your prescription drug co-payments. Those have a $1,000 limit or $2,000 limit per family. Here are how the co-payments compare between the different plans. Your PPO plans will have co-payments for office visits, $30 if you're visiting a primary care physician in the network, and $60 if you're visiting a specialist inside the network. Your urgent care center co-payments in the network are $75. The emergency room co-payment at any facility is $250. And your prescription drug co-payments are based upon the prescription that is written for you and what tier those prescriptions would fall into. And you can see from the slide what your co-payment would be for those prescriptions under the PPO plan. Once you make that co-payment, the balance of that charge for that particular visit is paid at 100%. These co-payments are only available to you if you are incurring the expense inside the network. Please remember, as you can see from the slide, all routine eligible expenses properly coded and incurred in the network will be paid at 100% for you, never subject to any deductible or any co-insurance or any co-payment. Most importantly to you, of course, is the payroll deductions associated with these plans. Here are the payroll deductions for each of the plans. As we mentioned, PPO Plan 1 with the lowest annual deductible will have the highest payroll deduction. HSA Plan 4 with the highest deductible will, of course, have the lowest payroll deduction. These were designed to give you a wide choice of deductibles and payroll deductions so that you could find a plan that best suits your needs and your objectives for covering and protecting yourself against medical expenses. We do need your help. We ask that you do communicate and that you do participate in the open enrollment program. We ask that you seek help in going through the choices. If you have any questions, you have your call center that you will receive in the packets that will have the phone number in there for you. Please access the call center. They are there to help and answer questions that you might have, as well as accessing your local HR manager and the HR professionals located at National Church Residences. I'm going to transition now from how your medical benefits are covered to how a health savings account works and how it might be advantageous to you. What is an HSA? It is a tax-advantaged account that you would establish at a bank or mutual fund house, if you would prefer, that can assist you to help pay on a tax-favored basis medical, dental, and vision expenses that you might be incurring out of your pocket throughout the calendar year. The health savings account plans will have a reduced payroll deduction as compared to the PPO plans, still provide you protection against your large catastrophic expenses, potentially make you available for this tax-advantaged health savings account. Please remember, the establishment of the health savings account is always voluntary. It is not required that you have a health savings account to be able to elect Plan 3 or Plan 4. This helps you perhaps understand how the two might work together, but it is not necessary that you have both. The IRS rules say that you could not be eligible for a health savings account unless you elect Plan number 3 or Plan number 4. If you were to choose PPO Plan 1 or PPO Plan 2, the Internal Revenue Service rules would prohibit you from having a health savings account. Let's take a look at the requirements that the IRS says that you must meet to be able to establish a health savings account. Well, the first requirement is to have your medical coverage under a plan that meets the IRS guidelines. We're happy to be able to announce that you will have 2 plans now to choose from at National Church Residence which meet the IRS requirements for a health savings account. The second requirement is that you cannot also have second coverage for yourself somewhere else under a plan that does not meet the IRS requirements. The third requirement under the IRS is that you cannot be eligible to receive benefits from Medicare. The fourth requirement is you cannot be claimed as a tax dependent on someone else's tax return. And the fifth requirement is that you or your spouse, if applicable, cannot be participating in a health care flexible spending account in the same year that you have a health savings account established. National Church Residence offers a health care flexible spending account plan. If you were to elect that, you simply could not have a health savings account in the same year that you have a flexible spending account. The IRS rules say that if your spouse participates in a healthcare flexible spending account where they work, that you would not be able to have a health savings account inside that same taxable year. Let's talk about the tax treatment and the tax advantages of a health savings account. The first tax advantage of a health savings account is contributions that you make to your own health savings account at the bank of your preference are 100% tax deductible from your income as you calculate the taxes that you're required to pay at the end of the year. You do not need to meet other itemized tax deduction requirements under the IRS code to take advantage of this tax deduction. So for example, if your income were to be $25,000 a year and you put $1,000 into your health savings account, when you go at the end of the year to complete your tax return, you are allowed to artificially deflate your income by $1,000 for tax purposes. As a result, you will owe less in federal and state income tax and have more money then to spend on items of your preference. So the first and most important tax advantage of the health savings account is your contributions are 100% tax deductible, and it helps you pay less in federal and state income tax. The IRS each year identifies for us the maximum amount that an individual may contribute to their health savings account. It's very important as you look at this slide that you remember these are maximum amounts that you can put in. You're never required to actually make any contribution unless the bank required it to your health savings account, and you do not need to tell the bank in advance how much you are going to contribute that year. You can determine your contributions throughout the year at your own discretion. The amount that you can contribute to the health savings account is predicated upon the election that you take under the medical plan. In 2015, the annual maximum limit that you could contribute to a health savings account is $3,350 if you elect coverage for just yourself on the medical plan. The IRS maximum limit, if you have any coverage for dependents on your medical plan, is $6,650 in 2015. It is very important that you remember, and of course your bank will help you with this when you establish your health savings account, but it would ultimately be your responsibility to make sure that you do not contribute more than what the IRS permits. You must prorate the contributions that the IRS were to allow each year by the number of months in the year that your health savings account is established. As you open your health savings account at your bank, ask them for guidance for this. They will be more than happy to provide it for you. For any individual that is age 55 or above, you are permitted under the IRS rules to contribute an additional $1,000 to your health savings account above and beyond what would be the normal established limits. If you are eligible to receive Medicare benefits, then you are no longer permitted to make contributions or establish your health savings account. If your health savings account had been established prior to being eligible for Medicare benefits, you may continue using the benefits for those advantages that the health savings account can provide for you. You simply could not make any more contributions to the health savings account after becoming Medicare eligible. Let's talk about the second tax advantage of a health savings account. You may use the money that you contributed into your HSA to pay for qualified medical, dental, and vision expenses that are incurred by you or any member in your family, even if they are not covered under your medical plan. And when you make the distribution from your health savings account to pay for those qualified medical, dental, and vision expenses, as long as it is for a qualified expense, it is a tax-free distribution from the health savings account. You do not need to pay taxes on the distributions. This can significantly reduce your net cost for your out-of-pocket medical, dental, and vision expenses. Those expenses are the ones that would be incurred by you, your spouse, and tax-deductible dependents. The qualified medical expense are the same that are permitted under the IRS code for flexible spending accounts. It is available to you on the IRS's website, irs.gov. In the search engine on that website, you could ask for Section 213D, and the complete list will be provided. A list is also provided to you on Connexus, so you can access the eligible qualified expenses here at National Church Residence as well. This list of qualified expenses is expansive. It can be for glasses, dental work. It could be for the expenses you're incurring against the deductible of the medical plan. It could be for prescription drug co-payments as well. It could be for contacts and contacts eye solution, LASIK eye surgery. The IRS permits a wide range of expenses that could be reimbursed to you on a tax-favored basis from your health savings account. Even some over-the-counter drugs are eligible to be paid for under the health savings account. The only requirement is that it be for a specific medical condition and that you receive a prescription from your doctor for the over-the-counter prescriptions. The health savings account tax-free distribution feature is a wonderful way to help reduce your cost for your dental, vision, and medical expenses that you are incurring throughout the year. With the health savings account, you are not required to submit the receipts of the expenses that you are incurring to the bank to be able to seek reimbursement for your expenses. You are to keep those expenses and, if asked by the IRS, to have them available to document that it was for a qualified expense for which you made the distribution. You're not required to send it in with your tax return, nor are you required to provide it to the bank for justification. As we've mentioned, if you make a distribution for a qualified expense, that distribution is tax-free. What if I needed to access my funds in my health savings account and it was not for a qualified expense? You simply withdraw the funds. It's not a loan. It's not a hardship withdrawal that you have to make a request. You simply withdraw the funds. You declare on your next tax return that you brought some money out for non-qualified reasons. Those funds would be subject to your ordinary income tax and a 20% tax penalty. So those funds are available to you. You would pay a penalty if you do bring them out, but they are controlled by you and can be used for emergencies if necessary. One of the key features of a health savings account is that funds that you have contributed to that account do not have to be fully utilized by the end of the year, or you lose access to those funds. With a health savings account, any funds left in the account at the end of the calendar year, all are available to you the next year. And there is no limit to the amount that you may accumulate inside your health savings account. There's only a limit on how much you may contribute each year. As a result, you may build up over a period of years funds in your health savings account to offset future expenses. If at age 65, when you become eligible for Medicare benefits, you may still continue to use the funds in your health savings account to pay for qualified expenses on a tax-favored basis. If after age 65, when eligible for Medicare benefits, you wish to withdraw the money for non-qualified expenses, the 20% penalty is no longer applicable at that time. As I mentioned, one of the advantages of the health savings account is it does not have the you must use it or lose it rule that is applicable to flexible spending accounts. You are not required to declare each year in advance how much you are going to contribute to your health savings account, and all funds remaining in your account at the end of the calendar year always roll over to the next year to be used at a future time. The health savings account are always owned and controlled by you. National Church Residences does not have any control or access to these accounts. You will identify who the owner of the savings accounts are. You will identify who the beneficiary of the account would be in the event of your death. You always control how much funds you will contribute to the savings account and for which expenses you would like to have reimbursed out of the health savings account. Most banks will provide you a debit card, and you could use that assuming money is available in the account at the time that you incur the expenses, or the IRS does allow you to reimburse yourself from your health savings account at a later date. Well, thanks for spending time with us today. We hope you found this information to be helpful, and we look forward to being of assistance to you during your open enrollment period. Danielle?
Thank you, Bill. We know a lot of information was covered today. Benefits open enrollment packets will be mailed the week of November 3rd with additional information about the plan choices. Again, open enrollment will begin the week of November 17th, and please remember that all full-time benefit eligible employees must take action. Thank you and have a great day.